Hi, and thanks for joining me. I'm Dr. Biggs, and today we're going to be talking about spider vein treatment with sclerotherapy and lasers. This is a very important video to give you some instructions about what to expect if you elect to come in for spider vein treatment here in the office. There are some documents that I believe I will post on the website, which you can print out, and that has additional pieces of information. But let's just review some of these things together. So what are the causes of spider veins? Generally, spider veins are inherited and occur whenever small capillaries dilate on the surface of the skin. Larger veins can be the source of spider veins, and sometimes they require a different assessment. And so if you're having any symptoms of heaviness, achiness, soreness, leg fatigue, if you've had varicose vein treatment in the past, or if you've noticed that you have ropey veins that are popping out of your skin, as well as the fact if you have a family history of venous disease and have had multiple family members, perhaps your parents or siblings or children, who have been noticed to have varicose veins popping out of their skin, then you may actually have more of a health concern rather than just spider veins, and that may require a different assessment in the office and perhaps an ultrasound for evaluation. But if you have small wispy veins that look somewhat like a spider's legs and they are not popping out of your skin, they're just present on the surface of the skin, then you probably have spider veins, and those can be treated with different therapies in the office. So, spider veins can sometimes worsen during times of hormonal shifts, such as at times of pregnancy and or menopause, and also at times of sustaining trauma. And so if you have had a traumatic injury or you've had a surgical scar on your extremity, then there's a chance that you've actually grown some small spider veins in that healing response to surgical injury. We'll talk about that more in a few minutes. And so the treatments in the office, I have both laser therapy as well as sclerotherapy to treat the spider veins. My personal preference is to address the spider veins with sclerotherapy first and foremost. I think it's a more effective treatment, and it is also considered to be the standard of care when treating spider veins. But we also have a vascular laser. So sclerotherapy involves placing an irritating solution into the veins to cause a controlled chemical inflammatory response. And the actual medicine that we use in the office is known as sodium tetradecyl sulfate, or Sotradecol. That's what we use here, and that's different than hypertonic saline. That used to be used more so in the past, and some people who have had that treatment will report that they may have noticed a stinging or burning sensation when it was administered. That was very common, and there was somewhat more of a higher side effect or complication profile with that medication. If it was injected and allowed to extravasate into the skin, there was a potential for having a cutaneous ulcer form. And so I feel that Sotradecol is a better medication in my office. And so the risks of sclerotherapy are very minimal. Most commonly, there could be a minor skin irritation at the injection site. That's actually noticed within the office. As soon as it is administered, we will commonly see a little bit of a skin elevation. It almost looks like a little bee sting or a hive. There's some redness that's associated with the actual injection, but it's pretty short-lived. I'd say that it lasts maybe 24 to 48 hours, but this is probably not something that you want to do right before embarking on vacation or some event in which you'd be showing your legs. With any injection, there is a risk of infection or an allergic reaction, but those are very, very rare. Hyperpigmentation or staining of the skin, called hemosiderin staining, can occur, and I hope to have some pictures of that on the video. But basically, that's a phenomenon related to trapping blood within the vessel after injecting the sclerosant into the vein. And so This pigment change can be subtle to dark depending on a person's skin type and their natural tendency towards staining. It tends to look like a little sunspot. Some people called them liver spots, I believe, in the past. Commonly, I've had patients tell me that they think it looks a little bit like a bruise. And so that would be a very common occurrence, to have some degree of bruising and or some hemosiderin deposition in the areas being treated, especially if the veins are larger in size. That could be an expected outcome. This will usually fade over time, usually within 2 to 3 months, but it can take longer for dark staining, even up to a year or more. So to decrease your risk of hyperpigmentation, it is imperative that you stay out of the sun for 6 weeks before treatment and for 4 weeks after treatment. I think a good rule of thumb is if you have any temporary darkness at the treatment sites, you want to stay out of the sun until they are gone. Another thing is that I frequently get questions about sunless tanning, either in a booth or the sunless tanning solutions that are applied to the skin. And because those still will elevate the activity of the melanocytes, which are the pigmented cells within the skin, you do not want to do those things if you have any sort of signs of the bruising or hemosiderin deposition at the treatment sites. So that's very important. You do not want to schedule this procedure right after a vacation. If you've come back and you're tan, you similarly do not want to go anywhere where you would be anticipating a large amount of sun exposure after this treatment. So please plan accordingly. That's very, very important. Your circulation will not be impaired due to the shutting down of these very small cosmetic veins. Sometimes we inject some slightly larger veins, and if we elect to do that, there's a chance that you would have a little area of firmness or lumpiness at the site where the vein has been injected. And if this happens, we can easily evacuate that in the office and get the little small clot within the vein out of the vein. So again, this is not a frequent occurrence. It's usually not a necessary thing to do after the procedure, but if you were to experience that, that's something we can address in follow-up. And we always offer a free evaluation after treatment. We have our patients come back at 6 weeks afterward just to assess their satisfaction with the treatment. And if we're concerned that you may have one of those little superficial lumps, we'll schedule your appointment sooner than that so we can see you and follow up. And you can always call us. Please call us if you have any questions or concerns. We're always here for you. So how many treatments does it take for my spider veins to go away? That's a big question. So spider vein treatment is a process. Spider veins do not appear overnight and they do not go away overnight, unfortunately. The average person would need 3 30-minute treatments to get the results they desire. But some people need as many as 5 to 7 sessions. Sometimes they need even more than that. It's very, very personalized and individualized. I tell my patients, when you're happy with your treatment results, then I'm happy with your treatment results. So take that into consideration. Because I haven't met you face to face yet, I have no idea how many spider veins you have, nor how many sessions you would need. So you would need to come into the office for me to be able to give you that information. So you can always stop treatment when you're happy with the results. You don't have to commit to a certain number of treatments. How often can I have treatments? Well, treatments can be scheduled as soon as 2 to 3 weeks apart. If we're working on different sites, I'm happy to treat both extremities on the same day, both lower extremities. We don't inject spider veins on upper extremities. But we can work on both extremities on the same day, and if we address all of the veins of concern, then that's great. I would wait a full 6 weeks before considering another treatment. But if we didn't get to everything, then you can come back sooner, 2 to 3 weeks afterwards, to have a second treatment session. And unfortunately, this will not be covered by health insurance. It's deemed to be cosmetic. There's some people have reported some pain at the site of spider veins, but it would be very unusual to have a health concern arise over a complication from a spider vein. I have had a few patients who have experienced bleeding at the site of the ankles with spider veins down there. And again, sometimes those folks have something else that's happening on a deeper level. It may need additional assessment. So again, this video is not meant to give medical advice. This is not in lieu of a face-to-face evaluation, but hopefully this provides some information so you understand more about this treatment before committing to coming into the office for a visit. Now, after instructions, these are super important. So after each treatment, you will need to wear the infamous 20 to 30 millimeter mercury medical grade compression hose for 24 hours straight. So you'll sleep in them. And then the next day at 24 hours, you would remove the compression stockings and the cotton balls and paper tape that have likely been affixed at the treatment sites. Beyond that, you would wear the compression stockings during the daytime only for 2 full weeks after treatment. And again, this is just based off of my experience, having been in practice now. I've been treating spider veins since 2008. So I guess for a good 11 years now. So the best results seem to be enjoyed by those that will commit to wearing their compression stockings daily for 2 weeks, taking them off to shower and to go to sleep. You may shower after the initial 24-hour period. I would avoid hot tubs and very, very hot showers for 1 week after treatment. And the reason why is that when you get into hot water like that, you've probably noticed you get a little bit flushed, you get a little bit vasodilated. Your blood is coming to the surface of your skin to cool yourself down. And it tends to open up the vessels in the process. And so we're trying to close the vessels. So it makes sense to stay away from things that vasodilate you for about 1 week after the procedure. For the same reason, I would avoid any sort of strenuous exercise that makes you hot, sweaty, flushed, and or breathless. That's probably a little bit too much exercise, at least after sclerotherapy. So take care and don't do that for 5 days afterwards. I mean, light yoga, walking, those things are completely acceptable, but this is a financial investment, and so you don't want to go out, I think, and do things that would compromise your results immediately afterwards. So that's the reason for that. So just ask yourself the question, is this going to make me hot, sweaty, flushed, or breathless? That's a little bit too much. I'd hold off on that for 5 days. If you were to develop an open sore or a large black spot on your leg, that would be highly unusual. And we, knock on wood, haven't had that problem in the office. And I would recommend calling the office immediately if you were to have that issue. You can reach me at any hour. So let's see what else here. You want to avoid sun exposure for 4 weeks afterwards. I think I mentioned that before. The rule of thumb was if anything was temporarily dark or appearing bruised, stay out of the sun, please. And no sunless tanner, no booths, sunless tanning booths either. Or spray tans, anything that elevates the melanocytes. I would avoid doing that. Bring your compression stockings to follow-up appointments. Presently, we offer compression stockings for sale here in the office, so they can be purchased on site. And we also have shorts for patients to change into in the office. If you'd like to bring your own shorts for treatment, that's fine too. I think that's it. So I hope that provides some information that'll make it a little bit easier for you to decide if this is something that you'd like to learn some more about, something that you'd like to do. If you have any questions after viewing our video, then kindly just give us a call at the office, 505-695-7070, and I or my staff will be happy to answer your questions. And I appreciate your time and your attention to this video. Thank you very much, and I hope you have a wonderful day. Take care. Bye-bye.